Hi, my name is Anastacia. I identify as a female. Yeah, I'm a nursing student. So my research here is on common pediatric heart conditions, and we found two different types. We have the congenital heart disease, and we have the acquired heart conditions. So the congenital heart disease is the one that's present at birth, and acquired heart disease is developed after birth, and it can result from infections, environment, and autoimmunity. During my research, I realized the most common congenital heart disease was the ventricular septal defect here. So it's just simply when there's a hole in the wall of the left and the right ventricles. So this is just a picture here of the normal heart and the heart with the ventricular septal defect right here. Okay, so another one I found interesting here was the Tetralogy of the Fallot, which is a combination of 4 different defects. So one of them is the overriding aorta, another one is the pulmonary stenosis, and we have the right ventricular hypertrophy, which is the thickening of the walls, and we have the large ventricular septal defect, all in one. Some of the signs and symptoms we found was decreased activity tolerance, cyanosis, fainting, heart murmur, chest pain, and this could cause like some implications on the child and family, which could be activity restriction, loss of normalcy, time away from school and work. And it's very interesting. I found the Ronald McDonald House, Edmonton, because they have to travel to Edmonton, and here it's $15 per night, and they'll have to get a referral from the nurse, and it's 5 minutes away from the hospital, so that's great. And we have here the acquired heart conditions. One of them is Kawasaki disease. I found this very interesting because the signs and symptoms are pretty different from what we usually see. So you can see here we have the red swollen lips and strawberry-like tongue here, bloodshot eyes, fever, lymph node swollen, fuzziness and irritability, rash all over the trunk. So it's pretty different. And it's treated with intravenous gamma globulin within the first days of the illness. Another one I found here was infective endocarditis, which is the infection of the inner lining of the heart, which is caused by bacteria in the bloodstream. And it's treated with IV antibiotics for 6 to 8 weeks. The last one I have here is the rheumatic heart disease, which is caused by acute rheumatic fever. It can result from strep throat, and it really damages the mitral valve. So we have here, if you want to pick a card, so a yellow card is for congenital and acquired is for the green card. So you want to pick anyone. Yeah, so that's acute rheumatic fever is the leading cause of rheumatic heart disease, and also causes like heart failure in young people too. It's pretty good that everyone gets this information so they can know how to manage it, and know that it's pretty common, and to look for the signs and symptoms, because when it is diagnosed early, it's treated better and earlier. So that's good. Well, maybe in the nearest future I would like to be like a CRA, yeah, anesthetist. So.